The circulation of oxygenated blood around the body, perfusion, is essential for the normal functioning of all organs and body parts. To assess perfusion, first observe the patient's skin for loss of color, pallor, or a bluish tinge to the lips or fingertips, cyanosis. For patients with darker skin tones, observe the inner aspect of the eyelid for pallor. Next, check the temperature of the extremities by feeling the patient's hands and noting whether they are cool or warm. Finally, assess capillary refill by compressing the nail bed of a fingertip, which is held above the level of the heart, for around 5 seconds, until it blanches. Then, record the time it takes for color to return to the nail bed. Normal capillary refill is less than 2 seconds. A patient's blood pressure can be measured manually using a sphygmomanometer. However, these days a digital monitor, for example a Dynamap, may be used instead. When using a digital monitor, the patient's blood pressure and pulse are displayed on a screen. Ideal blood pressure ranges from 90/60 mm of mercury to 120/80 mm of mercury. A low blood pressure of below 90/60 may occur during anaphylaxis or sepsis, although it is not always a matter for concern in healthy individuals. High blood pressure readings of greater than 140/90 can lead to dangerous conditions such as strokes or heart attacks if left untreated. The heart rate, also called the pulse, is the number of times the heart beats per minute. Depending on factors such as age, level of fitness and general health, the average heart rate is between 60 and 100 beats per minute. You should count the patient's heart rate for a full minute by palpating the radial artery, which is found at the wrist. Nurses often continue to palpate the radial artery for a further minute to observe the patient's respiratory rate, without the patient's awareness. A fast heart rate, tachycardia, of over 100 beats per minute, may indicate the presence of pain or infection. It is also normal for patients with hypothyroidism or anemia to have a fast heart rate. A very fast heart rate is sometimes called a bounding pulse. A slow heart rate, bradycardia, of under 60 beats per minute, can indicate a heart problem, although people who are very fit, for example athletes, often have a slow heart rate. A weak, slow heart rate is called a thready pulse. Some of the causes of a thready pulse include heart disease and dehydration.